The new virus is a strain of coronavirus, like SARS, which killed nearly 800 people globally in 2002 and 2003. Coronavirus infections have a wide range of symptoms, including fever, cough, shortness of breath, and breathing difficulties. A new coronavirus that has killed more than 170 people in China is spreading to other countries, alarming health experts. Here is some of what we know, and don't know, about the virus. What is the Wuhan coronavirus? The infection numbers are startling. Since January 20th, cases worldwide have surged from 282 to 6,057. The death toll stands at 132, according to Johns Hopkins University, which is tracking the outbreak. The current coronavirus doesn't have an official name yet. The current designation is 2019 nCoV, with 2019 for Year of Discovery, N for novel, meaning new, and CoV for coronavirus. When did the outbreak start? Where did coronavirus come from? According to Chinese officials, 2019 nCoV first appeared December 12 about 700 miles south of Beijing in Wuhan, a city with more people than New York and Chicago combined. Health officials say the outbreak originated at the Huanan seafood market. Huanan Seafood, closed by officials on January 1, was a wet market, one of a series of outdoor stalls selling fish and meat, some of it from wildlife. They are called wet markets because sellers slaughter and cut up animals and fish while customers wait. The market is suspected because coronaviruses transmit zoonotic diseases, meaning they are transferred from infected animals to humans. Researchers theorize that someone bought contaminated meat at the market, ate it, got sick and infected others, creating a ripple effect around the world. Bloomberg reported a 61-year-old man, a regular customer of the Huanan market, was the first to die from the virus. What are the symptoms of coronavirus? Common signs of infection include fever, cough, shortness of breath and breathing difficulties. Experts are unsure of whether the virus is able to transmit before symptoms appear or after. If it worsens, it can cause pneumonia, severe acute respiratory syndrome, kidney failure or even death. How dangerous is it? The new virus, identified by scientists as 2019 nCoV, is a coronavirus, a family of viruses that include the common cold and more serious diseases such as severe acute respiratory syndrome, SARS. Coronavirus infections have a wide range of symptoms, including fever, cough, shortness of breath, and breathing difficulties. It is unclear how deadly the new virus is. Although severe cases can cause pneumonia and death, there may be many cases of milder disease going undetected. Many of those who have died had pre-existing medical conditions or were elderly, those with weakened immune systems. A virus can linger in the air and infect people for 2 hours after an infected person leaves the room. How coronavirus infection rate compares with other diseases. How is it transmitted and how can it be prevented? The new coronavirus can be transmitted from person to person, although it is not clear how easily that happens. Most cases so far are in people who have been in Wuhan, family members of those infected, or medical workers. Transmission is most likely through close contact with an infected person via particles in the air from coughing or sneezing, or by someone touching an infected person or object with the virus on it and then touching their mouth, nose or eyes. In order to reduce the likelihood of transmission, the WHO recommends that people frequently wash their hands, cover their mouth and nose when sneezing or coughing, and avoid close contact with those who are sick. The U.S. Centers for Disease Control and Prevention says those who develop symptoms such as coughing and fever who have been in China in the last 14 days should call ahead to a healthcare professional to establish if they need to be tested. Where has it spread to so far? All but around 70 of the more than 6,000 cases so far identified have been in China, mostly in and around Wuhan. The other countries with confirmed cases include Australia, Cambodia, Canada, France, Germany, Japan, Malaysia, Nepal, Sri Lanka, Singapore, Thailand, South Korea, the UAE, the United States, and Vietnam. The WHO is looking very closely at cases of person-to-person transmission outside of Wuhan, which would suggest that it may have the potential to spread further. What are authorities doing? The Chinese government has put Wuhan into virtual quarantine to try and stop the spread of the virus. A number of foreign governments have advised against non-essential travel to China and have begun flying their citizens out of Wuhan. Is this like SARS? The new virus is a strain of coronavirus, like SARS, which killed nearly 800 people globally in 2002 and 2003. Unlike SARS, which also originated in China, it is believed the new virus can spread during the incubation period of 1 to 14 days, possibly before an infected person is showing symptoms. So far, the new virus does not appear to be as deadly as SARS, but there have been more cases overall.